It's 40 minutes after 10 o'clock. We're talking all things that have to do with skin cancer, which is a growing concern. And honestly speaking, there's a lot of misinformation. There's a lot of misconceptions as well around what skin cancer is and how one can also identify it. And I think just to, clarify that whole situation, just to get the information directly from the experts, it's very fitting for us to have a conversation with Dr. Rori Mathibe, who is a specialist dermatologist. It's been a long time.
Hi,
How are you?
I'm good on you.
I'm good. I'm good.
Good. Yeah.
Listen, it's such a pleasure to have you because,
Always.
there's my algorithms, right, Doc?
Mm.
They've been leading me to a certain type of cancer, and that's because I've been doing a lot of research around that because there is this whole
Yeah.
melanoma situation that we have, right?
Yes.
And, there's a lot of cancers that are out there, right? We only know of this popular one,
Melanoma.
melanoma,
Yeah.
right? But
Yeah.
maybe you can go on to unpack,
Yes.
the different types of skin cancers that are out there.
Yes. Yes, we have a lot of skin cancers out there. But you've mentioned melanoma, which is the commonest that we see
Yeah.
in practice. But we also have a category that we call the non-melanoma skin cancers. We're talking about cancers like squamous cell carcinoma, also known as SCC, or basal cell carcinoma, also known as BCC. So those are also one of the commonest skin cancers we'd see in practice. But also we've got cutaneous lymphomas. I'm sure you know a cancer called lymphoma. We do have the ones that will only affect the skin. We have many types, but I think in practice the commonest will be melanoma, squamous cell carcinoma, and basal cell carcinoma.
Okay, and growing up, we will be told to stay away from the sun and use sunscreen to protect
Yes.
ourselves from developing any kind of skin cancer.
Yes.
But what exactly are the causes of skin cancer?
Definitely. You know, with the sun, you are right.
Okay.
The sun is a trigger, but one shouldn't forget genetics. If you come from a family that has a high risk of developing cancers, breast cancer, uterine cancer, skin cancer, I think that already puts you at that risk of developing skin cancer. So
Yeah.
we'll always say there are genetic factors and there are environmental factors that will contribute in you developing skin cancer. So I've mentioned quite a few, like we've mentioned the sun, UV rays, and that's why there's this hoo-ha, and we always push as dermatologists for berekisa sunscreen,
Yeah.
because we're looking at the fact that some of us, we don't even know in our family who there's a genetic predisposition of developing skin cancer. So everyone, regardless whether there's a positive family history or not, one should use sunscreen. But other than that, we're also talking about lifestyle, smoking, alcohol consumption. Those things add on to the risks of developing skin cancer, especially when you have a predisposition. Your diet also plays a role, eating unhealthy diets. I think that is a broad approach of trying to prevent the development of skin cancer from as far as the environmental factors
Yeah.
are concerned.
Yeah.
Definitely.
And how do they differ in terms of aggressiveness, right? Because, when you mentioned melanoma and then you mentioned non-melanoma cancers, which is kind of
Yes.
confusing for me because everything that
Definitely.
is a non means that it might be benign or, you know what I mean? But,
definitely,
that's my thinking.
Okay. Hey,
But
yeah,
then,
no, hey, you are challenging me today.
but then,
Yeah.
but then, let's talk about the aggressiveness of
Definitely.
each cancer
Yes.
and the treatment thereof.
Definitely. Right. Melanoma. Most of a lot of skin cancers, they don't usually spread, but melanoma is that one. When we say you've got melanoma, we need to be very precautious and make sure that we investigate and we treat accordingly, because melanoma is one of those skin cancers that would actually metastasize. Either it could leave the skin and go to your brain,
Oh.
it can go to the lungs, so hence melanoma, a lot of people know about melanoma
Yeah.
because it's that one that would usually spread. Then we talk about squamous cell carcinomas or basal cell carcinoma. Those are they don't usually spread, but we do have those cases where actually it has left the skin and gone to other areas, especially squamous cell carcinoma. I have cases in practice where patients, when they came in already, it has metastasized. Basal cell carcinoma is one of those that love their environment. It loves where it is. It usually doesn't spread, but it will destroy where it is. You
Oh,
know, it will
so
go
the root,
deeper.
okay,
You know,
yeah.
But as you see, the non-melanoma cancers, they usually don't spread. So if we catch them early, we cut them out, you are sorted.
Yeah, and maybe let's talk about some of the signs and symptoms, right,
Definitely,
of skin
definitely.
cancers.
Yes,
Yeah.
definitely. And in practice, we always use the ABCDE approach,
Okay.
where we would say if you have a lesion, whether it looks like a pimple, whether it's darker in color, or if it's a mole, look at is it asymmetric? You know, look at the shape,
Yeah.
how it is and how it changes. You know,
Okay.
when we say changes, we're talking about the evolution in the ABCDE. That E is for evolution. Does it become ulcerated? You know, does it bleed? Is it painful? Is it tender when you touch it?
Yeah.
You know, and the changes that also don't make sense with you. I mean, if it's something it's itchy and then you constantly scratches and it develops an ulcer, we understand. But when that thing is not itchy, but it develops an ulcer on its own, then you should be worried.
Yeah.
You know,
Yeah.
and look at the growth of it, the diameter of it, the borders. Are they irregular? If it's something that is well circumscribed, you know, you can draw a clear circle around it.
Yeah.
I'm not saying don't come and see us, but those are the things that we look at. So if the edge is irregular, and then within that lesion you see different colors, and it changes into an ulcer, into a painful lesion, maybe there's pus, rather come and let's check it out so that we exclude things that can also look like cancer. You know, and also you can sleep well at night knowing that we've excluded the possible cancers on the skin.
Yeah. When I was young, I actually had a little bit of a scare, right? I had something, some sort of a pimple, but it was growing and it was starting to be painful. So here I am, I'm thinking, my goodness, I might have some type of cancer because I was such, in my head though.
Yeah, yeah.
In my head, I
In
thought
your
that,
head?
yo, my goodness. So what I would
Definitely.
do is that,
Yeah.
you know, we would go to the doctor often, right? Just to make sure. And then they only find that it was just a cyst, but it was, but the root was there. It had a root.
Definitely.
Yeah,
You see. So those are the things that we say can look like skin cancer, but they are not. So a cyst is it's a good example of something that can actually look like skin cancer, but it's benign. You remember you've mentioned something that is benign.
Yes.
So it's benign. It's not skin cancer.
All right. I want us to talk about the latest advancements when it comes to treatment with skin cancer.
Definitely.
You know, where are we in terms of technology as well? Maybe you can give us the latest where that is concerned.
100%. When you mention that topic, we get excited as dermatologists. Because, you know, there's a lot of technology now that is coming out that actually increases the sensitivity of picking up these cancers at an early stage. So in dermatology nowadays, we have a small device that we use in practice that is called a dermatoscope.
Okay.
It's like a mini microscope that will look at that lesion and it makes us at least be able to go deeper into the skin. You know, when I spoke about the ABCDE, you know, the asymmetry, this one actually goes deeper into the deeper levels of the skin, and then we can see some of the signs that will actually make us suggest that, okay, this is probably a skin cancer. Also, nuclear medicine, which are our colleagues in other departments. Now we've got injections that not everyone with skin cancer has to go and do a surgical procedure. Some, they are not as deep as the bad ones would be.
Okay.
So there are injections, you know, injectable medications that we can inject within that lesion to try and kill that cancer. We even have topical chemotherapy medications that are now out there that we even apply on top of the lesions to try and kill those cancer cells. So not everyone who has skin cancer will have to go the surgical route. There are many other options that we can use that can actually kill the cancer cells.
All right, and that concludes our conversation.
Definitely.
Thank you very much for
a
taking the
pleasure.
time to come all the way here to have a
100%,
conversation that's very, very
100%.
important, by the way.
Thank you so much. Thank you so much. Thank you. I'm happy that we are teaching guys out there to take care of their skin. And again, I'll always say this all the time when I'm here. Sunscreen is very good for you. You know, we did talk about what to look out for. It should be a broad spectrum sunscreen, UVA, UVB protection. If it's not written those things, that is not a sunscreen, that is a moisturizer.
Okay. Thank you for clarifying that.
Sure.
That is, of course, Dr. Rori Mathibe, specialist dermatologist. And that concludes our conversation.